everybody, I'm Dr. Richard Stevenson, and I'm the Director of Stevenson Dental Solutions in San Dimas, California. I'm also an Emeritus Professor of Clinical Dentistry at UCLA and have a private practice in West LA. Today we're going to discuss the full gold crown preparation on tooth number 3. The occlusal clearance needs to be 1.5 millimeters all over, following the original occlusal planes, and those planes should parallel the opposing occlusal surfaces. We need to include a functional cusp bevel and make sure our cusp tips line up with the arch. Take a look at the occlusal clearance here. From the left side, you can't really see the clearance, but when you tip the typodont 30 degrees, you should be able to see that you have 1.5 millimeters of occlusal clearance. The axial reduction should be 0.5 millimeters at the margin, 6 to 10 degrees of total occlusal convergence with a uniform taper. Try to keep the preparation 0.5 to 1 millimeters supergingival and make sure that the uniform chamfer finish line is very clear. The final preparation should be very smooth with a clear functional cusp bevel, no adjacent tooth damage, clean gingiva, and a clean typodont. The occlusal buccal bevel should be 0.5 and make sure we have 1.5 millimeters minimum of occlusal clearance. I'm going to suggest the following preparation steps. First, occlusal clearance, second, axial reduction, followed by interproximal clearance, then axial refinement, chamfer definition, overall refinement, and then the placement of the finishing bevels. I really like this Burr Kit that we have. It has 12 diamonds and 8 carbides. It is good for basically any prep you want to do. For the preparation today, we're going to focus on these burrs from the 837-012 all the way to the 7102-012, and I'll describe these burrs in more detail as we perform the preparation. Let's start with step 1, occlusal reduction. So for this step, let's use the 837-012, which measures 1.2 millimeters wide. It's a great burr to use for occlusal reduction because it's cylindrical shaped and provides a uniform reduction as you start the preparation. I like to perform the occlusal reduction by starting at this mesial buccal corner and working my way down in what I refer to as a reduction plane or a depth plane rather than a depth groove. And I can use the end of this burr, which we know is 1.2 millimeters, to judge how much we're removing as we progress down the incline of the mesial buccal cusp. We want to follow the planes with the right angulation from a buccolingual and a mesial distal perspective. So these are very similar to depth grooves because they reduce a known amount, but they're very different than depth grooves in the sense that they don't create a lot of difficult grooves to remove later on, because as you're reducing, you're maintaining the flat planes as you go. And notice you're rising up and down across these 4 planes on the C plane of the preparation. If you want to take a measurement and see how you're doing with the reduction, you can get an RGS-3 which measures 1 millimeter and see that we're going beyond that 1 millimeter. This is the 1.5. We're not quite 1.5. It gives us a little room for smoothing at the end. So let's continue now with the B plane, which involves the removal of the incline of the mesial lingual and the distal lingual cusps, and also the generation of the distal lingual groove. And we're doing this in the same manner. We're holding the handpiece at an angle so that it parallels the incline of the adjacent cusps. So if you look at the mesial lingual cusp on the second molar and the lingual cusp on the premolar, the angulation, the steepness, the inclination of those cusps is being paralleled with the burr at this point. And I'm not making any attempt to follow any nuanced undulations of triangular ridges along this cusp. I'm just making the cusp straight, in other words flat. Notice when we perform the reduction on the distal lingual cusp, I turn the handpiece a little bit at an angle so that I can follow distal lingual groove area, which means we're also following the oblique ridge. And all of this that we're doing right now is all part of the B plane. Now let's align the handpiece along the C plane with a finger rest, which follows the adjacent inclines, and then come over and start the A plane, or the functional cusp bevel. And once again, utilizing this depth plane technique rather than a depth groove technique. And when you've done this right, you're reducing 1.2 millimeters right now. And what's happening is the cusp tips are moving from a lingual position back to where they were originally. And this should be a crescent-shaped, continuous functional cusp bevel. There is one variation that we need to show you, and that is how you take the functional cusp bevel and you intersect the B plane and create the oblique ridge and the distal lingual groove. And notice there's a dramatic step from the mesial lingual cusp to the distal lingual cusp. And at this point we can do some refinement. You know, sometimes you end up with those little bumps between the reduction plane on one side and the reduction plane on the other side. So slow the handpiece down. I'm not saying slow speed, but I'm saying don't push the pedal all the way to the floor. And just gently work the burr along the grooves to remove any bumps from one side to the other, any little ditches, and make things a little bit more uniform. Performing a full gold crown typically requires about half of your time invested in just the occlusal reduction. The rest of the time will be axial and then your final refinement. So it's a very important step. It's one of the first things the graders look at, and if you're too conservative, you'll never be able to make a crown. If you're too aggressive, your prep will typically be short, and you may end up removing so much tooth structure that it's more pulpily compromised. So we want to be right in that sweet spot. At least 1.5 millimeters, probably up to about 1.8 millimeters would put you right in the 5.0 zone. And I say 5.0 meaning that would be the highest grade that a dental school would typically, or a board would typically give you. In private practice, probably more important than the prep is the impression, and that is an area where a lot of dentists struggle. So now you can see the finished occlusal reduction, and I've put the little red dots here to show you that the cusp tips on the prep are lined up along the arch with the other cusp tips. You can see the oblique ridge is maintained. There's a distal lingual groove. All of the inclines are following the inclines of the adjacent teeth and the opposing inclines of tooth number 30. Look at that oblique ridge, how it lines up just like it does on an unprepared tooth. This is really ideal. And you notice so we have a flat B plane on the mesiolingual cusp. From this view, it looks like we haven't reduced, but just with a little bit of a 30-degree tip of the Typodont, you can now easily fit an RGS-3, which is 1 millimeter, or an RGS-4 just fits right at that 1.5 level. So we're pretty happy. Let's start with the axial reduction, step number 2. And for this, we're going to use the 𝐸𝐴𝐳𝐭, which is excellent for creating a chamfer and the proper taper. It's really important to line up the burr with the line of draw of the tooth, which means that it's going to be tipping slightly towards the facial, and then engage the lingual with a good finger rest. At this point, you really want to try to remove enough tooth structure to allow the burr to settle into the chamfer. It provides for some more stability during the preparation. Right now I'm trying to keep the burr maybe 1.5 millimeters away from the tissue, and I'm also trying to go as far as I can interproximally, because the farther you go interproximally, the more easy it'll be to do the interproximal reduction in the next step. We're doing this with the high speed. It may not be all the way full speed high speed, but it's the high speed nonetheless. And let's take a look and see what we've accomplished so far. You can see how the burr is moving interproximally to create these little wings, and they are going to be done also on the facial. So we take the burr from the lingual with the same line of draw all the way over to the facial, and we start to engage the tooth structure in the same manner we just did on the lingual, starting out rather conservatively, keeping the burr about 1.5 millimeters away from the tissue and trying to establish a little bit of a chamfer that the burr can sit and rest on and keep it more stable. Obviously, your finger rest and your skills development will allow you to perform more burr stabilization just on your own, but it's nice to have a little bit of security by having that chamfer work to help keep the burr stabilized. And notice how we push the burr interproximally as far as we can, so that we can make the next step, which is interproximal clearance, a little bit less difficult. Sometimes I watch the video and I'm like, gosh, my hand wobbles around a little too much, and then I remember that I'm not actually looking at the tooth while I'm preparing. I'm looking at a video monitor while I'm doing the preparation, so it's not like I'm looking directly at the tooth. I'm also holding the handpiece pretty far away so that I don't have my fingers in the way. So those two things make this kind of challenging. It's kind of like playing a video game. It's pretty hard to do actually, but it's been really good to help train me to become a better dentist, I think. So now you can see that there's this small area interproximally that you need to remove, and this will be our next step, which is going to be step number 3, proximal clearance. And for this, let's use a needle burr. This is at 859 010, and it's 1 millimeter wide at its widest area, but the tip is very, very narrow. And what I typically do here is focus on the tip, and I go from the gingival and move it up occlusally, and I don't worry about the shape of the finish line. I'm not concerned about the location of the finish line. I'm really only focusing on removing that little portion of tooth structure that is still in contact with the premolar. And I'm going to not worry about the form of that margin. I just want to knock away that little remaining tooth structure. It sure makes it easier for us not to have to focus on so many things at once. Now don't go too deep axially, because that will be hard to recover from, and don't over taper, and don't hit the premolar. Those are 3 things. And see how we create a knife edge here? Now that is not an acceptable margin for today's procedure. We can do knife edge margins for crowns, but it requires a very talented laboratory to perform that. But basically, we're just creating a knife edge for now, and we're going to modify that with a chamfer in subsequent steps. Okay, we're almost finished here. Just have a little bit more to do on that distal. And notice we're just using the tip, which is really thin, probably only 0.5 millimeters at the tip. So it's really, really narrow. And I think we can work that down through that interproximal without hitting the adjacent tooth and without going too deep axially and without over tapering. Careful with these burrs. If you put your handpiece down on the counter or something and it hits a little too hard, these burrs can bend very easily and then they're useless. So they're rather delicate. Okay, mission accomplished. Now let's go on to axial refinement. So axial refinement is going back to the 𝐤𝐸𝐸 012 tapered diamond, and we're going to establish really nice, definite finish line chamfer. We're going to create uniform taper. We're going to follow the secondary planes. Secondary planes occur occlusal to the retentive ring of the preparation, and these are performed to follow the contours of the original tooth. It is a big mistake to just have one plane that goes from the finish line all the way to the occlusal surface. That doesn't follow nature, and that makes for a crown that typically will have thin areas as it reaches that occlusal portion. So these secondary planes are essential to provide for adequate thickness on the gold crown and definitely for ceramics. It's a real major problem with ceramics. With gold, you could probably get away with not having a secondary plane. But your provisionals will break all the time, won't they? If you've ever tried to make a provisional on a preparation that is minimally prepared, particularly in the area of like a secondary plane, your provisional will break. And if you deliver that on a patient, it'll break after their first meal and fall off, and then you'll be bringing them back to make a new provisional. And then it's going to be hard to make one that doesn't break until the crown is ready to go. So it's a good idea to make sure that you follow those secondary planes and that you create enough axial reduction to have structural durability in the final crown, but also in the temporary, and make for a longer lasting restoration. At this point, you should be feeling pretty good because you know your prep has got good taper. The finish line is about 0.5 to 1 millimeter above the tissue. You don't have any undercuts. You may not have the perfect axial wall, but you're getting it to the point where it is looking more uniform. And we're getting adequate reduction. I always feel good when I don't hit the adjacent teeth and I don't have any undercuts or problems with the finish line. It's a good day, right? So now with this, let's go into some finish work, and I like to utilize 2 diamonds to finalize the chamfer. And one of them is the 877 and the other one is its fine counterpart, which is the 8877. And these burrs are beautifully designed for chamfers. So I like using a slow speed in the friction grip, and this is little known by most people, that you can actually get this attachment, this push button that fits into your slow speed that holds all your diamond burrs and your carbides. It's phenomenal. So now I can use this to create a more refined chamfer. Now be careful because the burr is parallel, and if you don't pay attention to the axial wall inclination and follow that while you're doing this, you can create an undercut. So careful, but understand that the diameter of this burr is 1 millimeter, so 1/2 of that is 0.5, and isn't that the ideal chamfer? It is. So this is really great tool for creating the ideal chamfer size. This is the point where you also want to even out the finish line and make it more uniform with respect to the tissue. You also want to reestablish those secondary planes like you just saw us do there. And this makes for a fairly nice preparation. There are a few areas that need to be corrected, and this is a time for you to close one eye and look 12 inches away, and you're going to be looking through your mirror, and you're going to be looking for things like, can I see the wall? Can I see the finish line? Or is the finish line hidden by the wall? And that's really important. You also want to make sure that you have more uniformity of the taper, and that takes a little bit of effort to kind of go back and forth a few times assessing those things. Once you get to the point where you're pretty happy, let's go on to the next step, which is called overall refinement. And you could use any number of burrs for this. I like using the 8877 because I have it in the handpiece, and it's sitting there and it's really convenient. And I'm taking a dry erase marker to emphasize the depth of the scratches, and you can see that these scratches are 100 microns deep because that's the coarseness of the burr that we used. So by utilizing this 8877-010 in the slow speed, we can go over all of those planes once again, removing a little bit more tooth structure. Remember that we were about 1.2, 1.3 reduced, maybe 1.4 on the facial. We were looking at almost having the RGS-4 fit in there, but just a little bit more reduction is going to make it safely 1.5 millimeters. I like having the preps pretty smooth. There are those that argue that rough preps have more retention, but actually that's not really what we find. We find that smoother preps are much easier to fabricate a well-fitting crown. Crowns fit significantly better when the preparations are smooth. The impression materials are smoother, the dies are smoother, scans would be smoother, and we end up having a crown that can fit more intimately to a smooth interface than one that has a lot of roughness to it. And with proper retention and resistance form, we're not worried about crowns falling off because they're too smooth. So now let's talk about finishing bevels. And this is the 7404, which is a football burr, and it's a great burr to have. And then of course you also have this burr called the 7102, which is a flame diamond. And these two burrs can be used for creating little smooth contra bevels or finishing bevels on any preparation. I'm using it here in the slow speed, and I put a little dry erase material there on the tooth so you could see just how small this little bevel is, and it works pretty well. The other thing you want to do is you want to make sure that your functional cusp bevel blends back to the middle of the tooth on the lingual side, right? So don't just have it stop halfway, but have it taper all the way down to zero, all the way at the middle of the tooth. So at this point, I think we're basically done with the preparation. It's not a perfect prep by any means. I think it would get a pretty good score. There's always things we can do better, but it meets the criteria that we're looking for in a full gold crown. It has adequate clearance, it has good retention and resistance, it has clean finish line. Everything has met the criteria, I think, for a strong passing grade. And I hope that you've enjoyed this video, and I'll be making more videos as I find the time. And I thank you for watching. Take care.